Good morning, grade 5 students. This is your teacher in science for Miss Laura greeting you a scientific day. For today's session, we are going to talk about the lessons that we have tackled for week 9, and it's all about the major internal organs in the body and of course the diseases that affects the internal organs. So, let's start with our learning targets. The learning targets are: I can identify the diseases that affect the liver, stomach, intestines, kidneys, and urinary bladder, and I can infer the treatments or good habits to maintain a healthy liver, stomach, intestines, kidney, and urinary bladder. So in order for us to achieve our learning targets, of course, we were gonna be having the work plan. For the work plan, of course, during our synchronous time, you had the Science Bits reporters share their science bits. We are also going to have a recall, discussion time, the importance, and wrap up. So, last time, we talked about the different functions of liver, stomach, kidney, small and large intestines, and urinary bladder. These internal organs are very important in terms of the food that we take in, and of course on how the filtration in our bloodstreams happens. And of course, in order for us to be aware of the things why we should take good care of ourselves or of our internal organs, we should also know what are the diseases that affect the liver, stomach, small and large intestines, kidneys, and urinary bladder. So to start with, let us first have the diseases of the liver. Take note that the liver is the only organ that can easily replace damaged cells. But if ever that we are not taking good care of our liver, these damaged cells could give to the liver a lot of wounds which may cause cirrhosis. Cirrhosis is a permanent wound of the liver and it is really fatal in terms of our health. When you say fatal, it could eventually give risks into our lives. So when a person has cirrhosis, it will give him or her a kind of unhealthy liver. It is also presented in the screen of how does a liver with cirrhosis looks like, and eventually outside of our body it will eventually give us an idea that the stomach or the tummy of a person having cirrhosis will get bigger. Cirrhosis can cause or is being caused because of the regular or large amount of alcohol intake, and however it can be treated through medication and transplant. Aside from cirrhosis, we also have hepatitis A. Hepatitis A is ingestion of contaminated food or water. So when a person have already eaten contaminated food or water, that person can eventually have hepatitis A. Hepatitis A can also cause jaundice. When you say jaundice, it makes our white part of the eye turned yellow also with our skin. Aside from that, hepatitis A the cause of hepatitis A is contamination, direct contact to the infected stool or blood. However, the treatment is not specific, but the doctor would give us vaccination. Of course, they would eventually give us an idea or advise us to have a healthy diet and of course rest. Of course, aside from hepatitis A, we also have hepatitis B. Hepatitis B is the level 2 of hepatitis A, or in other words, it is worse than hepatitis A. Hepatitis B is inflammatory illness, or it is caused by exposure to infectious blood or body fluid of a person who has hepatitis B. Person who has hepatitis B, skin looks like this. And of course, hepatitis B's cause is virus or toxin or too much alcohol intake. And however, it can be treated through medication, transplant of the liver, and vaccination. We also have what we call hepatitis C, but hepatitis C is more worse or is more challenging than hepatitis B. We also have what we call liver cancer. When we talked about liver cancer, it is a cancer cells, or these are cancer cells that eventually emitted or eventually started in the liver. Liver cancer can also be called hepatic cancer. Hepatic cancer cause are hepatitis B or C infections, cirrhosis, toxins, steroids, and smoking. However, liver cancer can also be treated through surgery, transplantation of the liver, and of course, chemotherapy. Now let's go to the problems of the stomach. First is the indigestion and or what we call dyspepsia. What is indigestion or dyspepsia? It is an impaired digestion with feeling of fullness, discomfort after meal without any organic disease. So when we say indigestion, it is somehow experienced when we eat food and eventually we turn uneasy or our stomach is in pain. Indigestion's cause is or are swallowed air, dairy products, depression or anxiety, caffeine, or alcohol. However, indigestion can also be treated through prescribed medication. And of course, we should take an advice of the doctor of what else should we do if ever that we experience indigestion. Aside from indigestion, gastritis is also one of the problems in our stomach. Gastritis is an inflammation in the stomach lining. In other words, there is risk if ever that we have a gastritis. Gastritis or the cause of gastritis are alcohol, anti-inflammatory drugs, bacteria, and infection. Gastritis can also be cured or treated through medicine like antacid or histamine being prescribed by the doctor. Aside from indigestion and gastritis, our stomach also bleeds. Stomach is bleeding and it gives us sore pain inside of us. This part of our stomach is the inner lining that bleeds. Stomach bleeding's cause could be gastritis, tumor, or cancer sometimes. However, stomach bleeding can also be treated or can be cured through blood tests, endoscopy, and magnetic resonance imaging scan. And lastly, one of the problems in our stomach could be peptic ulcer. Peptic ulcer is the weakening of the stomach walls and eventually it releases a lot of acid causing us to feel pain. Peptic ulcer can happen if ever that we are not eating our meals on time or we skip meals regularly. Aside from that, peptic ulcer can also be caused by bacteria. However, this problem can be treated through stop alcohol intake or smoking and avoid unprescribed medicine and surgery. We are done with the problems of our liver and of our stomach. Now let's proceed with the intestinal problems. The first one is the colitis. People who suffers from abdominal pain, loss of appetite, fatigue, diarrhea, cramping, urgency to urinate, and bloating could be some of the symptoms of colitis. Colitis is the inflammation of the large intestine or the colon. If you would notice in the image, the red thing would be telling us that the colon is suffering from inflammation or a pain inside of us. Okay? So, in order for us to have a healthy colon, there should be a care or we should show care into the intestines or into our intestines, and eventually we should intake or take foods which are fiber-rich food or we drink a lot of water. Colitis is also caused by various bacteria and parasites. However, this could be treated through physical and diagnostic examinations, checkups, or medications that can be given by the doctor. Aside from colitis, we also sometimes suffer constipation. Constipation is the bowel movement that are frequent that cause painful defecation. So this time, and when we experience constipation, it's somehow you need to go to the bathroom, you need to bring out your waste, but it's hard for you to bring it out. Constipation's cause could be improper habit, diet, overuse of laxatives, or hormonal disorders. However, it could be treated when we eat food high in fibers and of course with the prescribed medication given to us by our doctor. Aside from colitis and indigestion, we also have diarrhea as one of the intestinal problems. When we go to the bathroom 2 or more times to lose liquid bowel movement per day, this is called diarrhea. Diarrhea can also cause dehydration. And when we are dehydrated, that is already serious when it comes to our health. Diarrhea is caused by virus, bacteria, and parasitic infection. Aside from that, food poisoning and medication. When say medication, you are taking in prescribed medication, but then there are side effects which will cause us to suffer from diarrhea. However, if we have diarrhea, it could be treated through prescribed medication. And lastly, we also have gastroenteritis as one of the internal problems of our intestine. Gastroenteritis is also called stomach flu. A person who has gastroenteritis can suffer from diarrhea, vomiting, and cramping on the same experience. So this is because of the inflammation of small and large intestine. Gastroenteritis is caused by bacteria, infection, or even eating raw and uncooked food. However, gastroenteritis can be treated through drinking tea or ginger, hydrating, like eating ice chips, avoid solid food intakes, and of course, vaccination can also be done. So those are the different problems in our intestines. Now let's proceed with the diseases in the kidney. The first thing is the kidney stones. Kidney stones are solid masses of tiny crystals, or we call them stones. This eventually happens when we are not drinking a lot of water, and then these toxins would stay in the kidney and eventually mold and form into stones. So the cause of having kidney stones can be drinking too little water, exercise too much or too little, obesity, weight loss, surgery, or eating food with too much salt or sugar. However, we should take good care of ourselves and ask for the guidance of the doctor. So this could be treated through prescribed medication, sound or shock waves, and of course, surgery. Aside from kidney stones, we also have kidney cysts. Kidney cyst takes the place of the normal tissue, enlarging the kidneys and making them work poorly, leading to kidney failure. So these cysts are just normal tissue, but eventually they grow larger, and eventually they make the kidney not work or poorly to work. Kidney cysts, or people who has kidney cysts, can eventually suffer from pain in the back and the lower side, UTI or urinary tract infection, or blood urine. However, kidney cysts can be treated through ultrasound, medications, and surgery. So aside from kidney stones and kidney cysts, our kidneys can eventually also have cancer. Kidney cancer is a cancer that started in the kidney. Its development of mass tissue in the abdomen and or with the presence of blood in the urine. So eventually it can grow. Kidney cancers are being shown in the screen. The fleshy fatty thing that you can see in the middle of the kidney are what we consider the cancer. Kidney symptoms could be tiredness, loss of appetite, weight loss, high body temperature, and heavy sweating with persistent pain in the abdomen. However, This could be treated through prescribed medication, sound or shock waves, surgery, and even chemotherapy. So, those are the different problems in terms of our kidney. Now, let's proceed to the different problems in our urinary bladder. Take note that the kidney and the urinary bladder are connected to each other. This is because of the urethra, wherein it is the passageway of the urine that came from kidney and will eventually goes down to the bladder. So, we also have what we call cystitis, which is a urinary bladder inflammation, or it is also considered as urinary tract infection. So this happens when we tend to not bring out all the waste, or we tend to skip urinating. So when we skip urinating, the bacteria will eventually travel up to the urethra down to our bladder, and it eventually gives us inflammation and of course inflammation and bacteria infection. So the symptoms could be frequent urinating with burning sensation and abdominal pain. However, this can be treated through prescribed medications, or when we take in antibiotics being prescribed by the doctors. Of course, lastly, we should also have to drink 8 to 10 glasses of water every day. Our bladder can also rupture. So when we say rupture, there will be a hole on it because we eventually did not empty our bladder. Eventually, it will rupture if we're not going to empty, or it is overfilled with urine. So the symptoms can be localized pain, or it could eventually give us poison, or it's poisoning us. This can be treated through surgery. So these are the things that are the problems that eventually gives us an idea on how we should take good care of our internal organs. If we do not take good care of our body, then we should know first what should happen if we are not going to do this stuff. So I hope we were able to achieve our learning target to identify the diseases that affect the liver, stomach, intestine, kidney, and urinary bladder, and of course infer what are the treatments and habits in making our internal organs healthy. So thank you for your time, grade 4. I hope to see you next time. Have a scientific day. God bless.